Hello, it's Dr. Garrett Pullman, host of the Prostate Health Podcast. Today we'll be discussing a sensitive topic. Many couples find themselves unprepared and overwhelmed when dealing with the sexual consequences of prostate cancer treatment. The road toward healing can be a challenging journey. We'll be discussing the importance of communication and restoring intimacy and how that can be accomplished following prostate cancer treatment. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On a weekly basis, we will be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pullman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. Joining us today on the Prostate Health Podcast is board-certified urologist Dr. Kelly Casperson. She is founding member of Pacific Northwest Urology Specialists in Bellingham, Washington. She practices comprehensive urology with a focus on female urology and urogynecology. She treats pelvic organ prolapse, urinary incontinence, recurrent urinary tract infection, genitourinary symptoms of menopause, and female sexual dysfunction. When she is not in her clinic, she loves being a mom, wife, and educating women about their bodies and sexual health with her podcast and Facebook page, You Are Not Broken, where her mission is to help empower women to live their best love lives. Combining the power of mind work, body science, and relationships, she joyously breaks down the societal barriers that are keeping couples from awakening into their best intimate lives. Dr. Casperson, welcome to the Prostate Health Podcast.
Thanks for having me, Dr. Pullman.
Now, Dr. Casperson, did you always have an interest in female sexual health?
No, I didn't. And I think everybody comes into it with their own story. And I did a wonderful residency for urology, but we talked about male sexual health, but not female sexual health. I remember being told that females were just too difficult or females were just too complicated. Like it was kind of this honorable thing that they were just too complicated. And I think, the science has really come a long way since then. And there's been a lot of research there are wonderful ways to help women. But I still didn't have it as much in my practice as I do now until I had a patient who was a cancer survivor. And we had successfully treated the cancer and she was doing great. But she came into my clinic and just started crying and saying, I have a great marriage. I love my husband, but I don't want to be intimate. I can't be intimate. It hurts to be intimate, and just crying. And I remember being there and being like, I don't know how to help her. And so she left that day with a 1-year follow-up for her cancer treatment. And I said, I need to figure out how to help these people, because if this is her story, there's got to be thousands of these stories. And so she came back the next year and same thing, crying in my office, same story. And I said, now I have ideas. So she's really the person that I have to thank in the work that I'm now doing to help everybody else.
Yeah. Wow. What a powerful story. Well, Dr. Casperson, many couples find themselves in a difficult situation after prostate cancer treatment. Many often unprepared and overwhelmed when dealing with the sexual consequences of the various treatments. The road toward healing can be a challenging journey. One of the biggest hurdles men have is actually starting the conversation about intimacy with their loved ones. Would you agree with this?
Yeah, I think, especially with the cancer treatment or any sort of health diagnosis, there's a lot of stress involved in the relationship and changing dynamics within the relationship just because of that's going on. And now you're bringing in another topic that is really important to relationships, but maybe also has never been talked about before. And certainly with some cancer treatments, the side effect does affect that part of the relationship. So it's complex for many reasons. The other thing that makes things difficult, I think, for a lot of men is that they've never had troubles with their sexuality before. A lot of men, it's just kind of like plug and play, it's always worked for them. And to all of a sudden have that not work on top of a cancer diagnosis, on top of maybe changing roles in the relationship, like caretaker and somebody who needs more care, it's really overwhelming. There's a lot of pieces there.
Yeah, certainly. So what recommendations do you have for these couples to help really, begin the discussion about sex?
Well, I think, one thing that a lot of men have challenges with is they really wrap up their sexuality and their almost definition of manhood in their erections. And I am not here to speak for all women, but I think a lot of women don't actually see their partner defined as a man because of his penis or his erections. But that can be a very, very difficult thing, because if his ego is wrapped up in my manhood, it's a very challenging place to kind of start that discussion. So for the men out there, you're no less of a man because you have a side effect from cancer treatment. And to speak kindly for the women, I don't think most women think about men that way, if that's helpful for men to hear. It's always an awkward conversation. This is an awkward conversation in the best of relationships when there's not cancer diagnosis involved. So just remember, it's always awkward, and it's awkward for everybody. This is part of my career and what I do, and it's still awkward to talk about these conversations. So just kind of acknowledging that it's a challenging topic to begin with kind of helps you feel not like you're the only one who's having challenges with this topic. And then in thinking about, having difficult conversations, you can think about your comfort zone and realizing that talking about sex is outside your comfort zone. But that's where you're going to learn, and that's really where the relationship can grow. But then realize that there's this outer circle that's really kind of the panic zone. It's like, I'm very uncomfortable, it's too much, kind of get back into that learning zone and kind of thinking about, if you don't ever get out of that comfort zone to talk about sex, you're not going to kind of progress and have some breakthroughs. There are so many different tips. Another tip to be is to use I statements instead of you statements. So that can really take the pressure off of the partner, as the partner feeling like they're the one who has the problem. So intimacy is very important to me. I feel like our intimacy hasn't been what it has been, and really kind of make it about you when you're talking to somebody about that takes the pressure off of them as you saying or feeling like they're the one to blame for it. And then always remember to put in there, the good things, or what we call the sandwich of a positive thing, some constructive feedback, and then a positive thing. Like, I absolutely love my relationship with you and I love being close with you. Then put in the concern you have. But I feel like since the cancer diagnosis, we haven't been able to be as intimate. And then a positive thing of, I've been reading a lot about this because I know that lots of people have this problem. Do you think that that's something we could talk about? So, you put in the challenging part in the middle of that positive sandwich can also be a way. So what I find really helpful is actually, talking out loud or write it down, or kind of think about how you're going to bring this up with your loved one, because it's always challenging.
And you mentioned, kind of touched on this a bit, but certainly there are a lot of challenges for men in having this talk about intimacy and sex with their partner. What are some of the common challenges that you see?
Yeah, I think, I just saw somebody recently and he was very, very focused on his erections. The erections he thought was the problem for the whole relationship. He was very goal-oriented on the erections, and his partner was with him. And I said, tell me about where this focus on the erections is. Why is this the most important thing right now? And he said, I want to feel closer to her. And I said, why is the penis the thing that's going to make you closer to her? And really rethinking what intimacy and a close relationship and feeling bonded with your partner is. And certainly the sex that you've always had might not be the sex or the intimacy that you're going to have going forward. But opening up that conversation in that clinic visit, the partner realized that he was really wanting to be close to her. And he was using his erection as the way that he thought he needed to be close to her. And once you actually break that down, you learn so much more about the relationship. The other thing to realize is that men and women usually will have sex for different reasons. And men use sex more than women use sex as a way to be close to their partner. So when a man might have challenges with erectile dysfunction, his sense of feeling close to his partner might feel more changed than what his partner is noticing. So notice that the dynamic will change for each individual person.
So what are some of the consequences of not having open lines of communication regarding intimacy?
Well, I think it's the elephant in the room, right? So the more that you don't talk about it, and if it is an issue, it can just become a bigger and bigger issue, because then you start doing things to avoid going to bed at the same time. You start doing things to not even have the situation of intimacy come up. And, worst case scenario, if intimacy in a sexual relationship is how you're close to each other, without that, relationships do really drift and fall apart. Or as people say, he became my roommate. So you have a great partner bond, but that romantic sexual situation is no longer there.
Now, will you typically recommend these couples meet with a counselor to assist in reestablishing intimacy?
Yeah, I think, urologists, we're surgeons, we're great at treating the prostate cancer component and walking people through that, but we're really not trained in the kind of biopsychosocial complexity of these relationships. I'm probably a better sex therapist now than I've ever been, just in all of my learning into actually how to have these conversations. But I think one thing that really allowed me to help people through this is me realizing that I'm not a sex therapist and me finding those people in my town to refer to. But even just, as I was going back to that patient example, when I said, why do you think that the penis is the thing that's going to make you feel close to her? And the partner, she was actually brilliant. She picked up on it. She's like, that's a therapy question. And it's like, yeah, well, those kind of big questions are probably out for I'd say the majority of urologists out of their realm of expertise, and having people that you can refer to. And for any sort of care provider, whether it's a primary care doctor, nurse practitioner, anybody who's caring for people in relationships, number one, there's nobody who can't get better at sex. Number two, if it's a person in your office, they're probably a sexual being. So this really involves anybody, any person you're going to see in healthcare. Knowing who your sex therapists are, or therapists that are comfortable with these topics, is going to be a useful resource for your patients, even if you're not specifically seeing prostate cancer patients.
Certainly. So what are some of the additional benefits of seeing a sexual counselor then?
I think having a neutral place. So saying, hey, we're going to go here, and just for this hour, we're going to talk about it. And so it kind of takes the pressure off this always being this issue that isn't being talked about. So it's a nice neutral place. And it's also somebody who's already trained in this that's going to be very normalizing for you to say, oh, I see people with this problem all the time. And just normalizing it and making people not feel broken, not feel like they're the only ones, can just take a huge stress off of the relationship. And plus, the sex therapists are really trained in techniques of saying, hey, why don't we talk about what we can do that is for pleasure, that helps you guys feel close? And there's just great kind of scholars in all of that I know that urologists and the average doctor, we're not trained well in that.
Thanks again for joining us today on the Prostate Health Podcast. If you're enjoying the show today, make sure you visit my podcast website at www.prostatehealthpodcast.com. There you can find show notes to all our episodes. You can also click on our resources tab, where you can find links to our trusted partners of the podcast, as well as links to books, resources, and products, all of which can help in your journey with either an enlarged prostate or prostate cancer. You can also sign up to receive my free What to Expect guide, which includes checklists of what you need to bring and how to prepare, including what to expect with 3 different scenarios, including your initial urology clinic appointment, a prostate biopsy, or prostate cancer consultation. Sign up for the free guide on the homepage of www.prostatehealthpodcast.com, or access this guide directly at www.prostatehealthpodcast.com/clinic. So how might these men and their loved ones go about finding an appropriate counselor to go see?
It can be tricky. It's better now than it ever has been. But I actually had a sex therapist tell me this, like, sex therapists they're just therapists that are good at talking about sex. So that's number one. And think of it a lot of like doctors, like a lot of great doctors, but they're not all comfortable talking about sex. So these are therapists who are usually traditionally trained in regular therapy techniques, who are very comfortable talking about sex. So if you can find a therapist that is open and kind of advertises that they're comfortable talking about it, that's probably going to be your best bet. If you're lucky enough to have an AASECT certified sex therapist, that's AASECT, that's kind of the big certifying body in America. It's very rigorous training. You have to do a lot to be an AASECT certified therapist. So the point of that is there's not a lot of them. I think in the greater Seattle area, there might be 4. For an example, my town's super blessed. We actually have 3 in my town. So we're pretty lucky. But point being, they're few and far between, but certainly more than there ever was. So you can go on the AASECT website and find a therapist that way. My only caution with just a regular therapist is just because they say marriage therapist doesn't mean that they're great at talking about sex. And I've kind of learned that from my sex therapist. So be picky. This is your goal. You deserve to be picky and find the right one. And there's plenty of people that can do, there's telehealth now, there's online counseling resources. So if you live in a smaller town or maybe a more conservative town where we don't have these people, there's still great people online.
That's great. Thank you for sharing that. So Dr. Casperson, with many couples working through some of these difficulties with erectile dysfunction, including not having adequate erections for intercourse, Now, and we kind of touched on this a little bit, but now often a misconception, again, for many would be that penetrative intercourse is not the only way to reach a climax. Can you talk to our listeners a bit about this?
Yeah, I mean, I think this is the big aha for a lot of people, because you have to go back to how we were taught about what sex is, right? Like, in order to even conceive that there might be ways to achieve orgasm or sexual satisfaction without penis and vagina sex, or traditional sex, or PIV is what the experts call it, you have to go back to how people learned about sex in the first place. And that's through movies, through social media, maybe through porn use. And a lot of that is not actually descriptive of how female bodies work, or male bodies for that matter. So going to even to open that can of worms for somebody to be like, did you know that most women actually don't climax with just penises in the vagina? Like, most people don't know that simple fact because they didn't get educated in the kind of a biological science sort of fashion. So certainly for women, erectile dysfunction or not in the spouse, just achieving sexual satisfaction, it's pretty rare. It's less than 20% that a woman will have an orgasm with penis and vagina sex. And just saying these things to my patients is very normalizing to them, to say like, oh, I thought I was the only one. I thought I was the broken one. Or maybe they've had a man tell them that they were the broken one. So our education in sex in this country is certainly coming from a place where more knowledge and more science-based and evidence-based dialogue really helps people feel like they're not broken, they're not alone.
Now, can you comment regarding some of the changes men see after prostate removal in terms of orgasm?
So a couple of things. The one most commonly talked about is erectile dysfunction, because of the way that the nerves for erections of the penis run right around the prostate. And certainly if it's an advanced prostate cancer, they might have a non-nerve sparing procedure, or other prostate cancer treatments like radiation can also damage the nerves. So erectile dysfunction is the common one talked about, but the other one can be incontinence. You can have a little bit of incontinence with orgasm because the sphincter is not as strong, or just having the prostate removed doesn't have enough kind of power to hold in the urine with a forceful pelvic muscle contraction. The other thing you can see, certainly with any prostate cancer treatment, is dry ejaculation, which is not a dangerous thing. It's not a bad thing, but it might be a change in sensation for man to not feel that fluid going through the urethra. You know, I lightheartedly joke with my people and I say, well, that's actually if you need to have babies, it's good to have an ejaculation. And they're beyond the age of fertility being an issue. But certainly if fertility was something that was important, that could be affected.
So again, the most common problem affecting men is erectile dysfunction. Can you speak a bit about the most common problem for women negatively impacting them and their ability for sexual intercourse?
Oh, sure. So the most common reason that women see doctors for sexual dysfunction is called hypoactive sexual desire disorder, or HSDD, which is a big mouthful, but basically decreased desire. So that is a huge topic. And one of the ways I really normalize that for women is teaching people about the difference between responsive desire and spontaneous desire. So again, how are we taught about sex? How are we taught that we're supposed to be sexual people? As we're taught we're supposed to always have the spontaneous desire. And a lot of women, even young women, but as they get older and hormones change, they turn into a more responsive desire instead of spontaneous desire. So we think we're broken because we're not just spontaneously wanting to have sex all the time, which if you think about it, you're like, we work, we have kids, we've got a dirty house, we've got a project due at work. It makes no sense that we'd be spontaneously seeking out sex in the midst of an otherwise very busy life. But if you have responsive desire, which means, hey, my partner's home, he's showing interest in me, the touch feels good, and then you're into it and you have a satisfying experience, that is completely normal. And that not only normal, that's the majority of women's sexual experiences. So I've had so many women in my clinic just have such a sense of relief of being like, oh, I'm normal. And I said, if you go to the party and the party is good, you're normal. You might not want to spontaneously seek out a party, but once you get there, it's a nice party. You're glad your partner took you. Great. You're totally normal. You don't need to do anything else for you. That's a normal sexual response, especially more for women, but men have responsive sexual desire as well. So I'd say number one, the biggest thing is low sex desire. And then number two would be changing hormones and the genital urinary symptoms of menopause. So the vulva and the vagina, the urethra, the clitoris, all of the tissues down in the female pelvis became female because of their exposure to estrogen. That's how they developed into their structures. So what happens with menopause and perimenopause is that estrogen goes way down. So the tissues become thin, the tissues become dry. And the way I talk to patients about this is I say, this is just skincare. We put SPF on our face every single day to protect our skin. We want beautiful, healthy skin on our faces. We don't want it any different down in our vulvas. Because when that skin is moist and happy and is at the right pH, it actually prevents urinary tract infections and it prevents pain with sex. And it allows the elasticity of the vagina to have comfortable sex. So if that's not addressed as a woman gets older in her 40s, 50s, and onward, certainly 10 years after menopause, I start seeing it very, very significantly. That education in this country is missing. We're living longer, we're wanting great sex lives, but if we don't address the lack of estrogen in the vagina, uncomfortable things can happen, and you don't want to do things that are uncomfortable. So part of that desire is you don't desire things that are uncomfortable. So just having great skincare and keeping the tissues in the pelvis full of that estrogen helps you have a good party to go to.
So in summary, there are certainly challenges to overcome for men and their loved ones when trying to restore intimacy following prostate cancer treatment. You highlighted the importance of communication today and ways in helping couples begin this discussion. Dr. Casperson, any final thoughts for our listeners today?
You are not broken. You're more normal than you think you are. A little bit of education goes a long way. And if a good sex life is something that you desire, work at it. It isn't always fixed, in one session with your partner and talking about what works. It's like exercise, or, you just got to keep doing it and exploring it and learning with it and give yourself a lot of grace. Because at the end of the day, a good relationship with your partner is worth it, but it does take some work.
So how might our listeners go ahead and find your podcast to listen to?
So I'm up on Spotify and iTunes and most of the other major ones at You Are Not Broken. And then I have a Facebook page that's public that's also called You Are Not Broken. And I love it when people it's mostly private messages because it's a personal topic, but they private message me and it gives me good ideas for future podcasts. So I really love communicating with people that way.
Excellent. Dr. Casperson, thank you again for joining us today on the Prostate Health Podcast. You have certainly given our listeners a lot of valuable information today that will help empower them in restoring intimacy following prostate cancer treatment. Thank you again.
Thanks for having me.
Thank you again for listening to the Prostate Health Podcast. We would love to have you join our podcast Facebook group at www.facebook.com/groups/prostate health podcast, or just use the Facebook group search function and search for the Prostate Health Podcast and ask to join. We'll see you at the next episode.